everyone for joining us today on the Stockton-San Joaquin County Public Library Facebook page. My name is Denise Davis. I'm with the Alzheimer's Association, and we'd like to welcome you today. And I'm going to talk a little bit about the Alzheimer's Association programs and services that we have in San Joaquin County. So we have we have 11 local Alzheimer's Association offices that cover Northern California, from Bakersfield to the Oregon border and Northern Nevada. And one of those regional offices is our Sacramento office, which covers San Joaquin and 7 counties in the greater Sacramento region. We have support nationwide with regional offices in every state to support our communities where families and individuals alike live. As we know that families might have loved ones that can provide extra support that might live in a different state than California. So it's always great to have that additional resource across the United States. We also have a caregiver support group that meets every month. That caregiver support group meets the 3rd Tuesday of the month at 6 p.m. at St. Joseph's Medical Center. And we usually do meet in person at that support group. It's a great evening support group, wonderful for maybe family caregivers who are working outside the home, for partners, for spouses who might prefer to go to an evening support group, really built up for anyone who's a family caregiver that can attend that support group. And of course, like everything else right now with COVID-19 happening, that support group is virtual. So for that, in addition to our other services that I'll be talking about now, anyone can call and ask how to log into that support group. And I'll give that information in just a little while. So I just really want to, again, thank so much to Carrie Leos with the Stockton-San Joaquin County Public Library for inviting us today to come and provide some information for family caregivers around dementia, around programs and services, and Alzheimer's disease. So another question that we often get is, do you offer classes or workshops for caregivers? And yes, our local programs and services include the support group that I mentioned, and in addition to many other support groups and educational programs, with many that are geared toward informing and empowering individuals in the early stages of their diagnosis. Our programs are offered free of charge, and many are available in multiple languages. Our education programs can also help you understand what to expect, so you can be prepared to meet the changes ahead and live well for as long as possible. Support groups, as some of you might know, can be really helpful, especially when a person is facing difficult times. Having a good support group network one can turn to for advice and encouragement may help that person feel socially connected and also give a sense of belonging and purpose. Connecting with others may help put one's own experience living with the disease in perspective and provide that individual with the support and encouragement necessary to move beyond the diagnosis and providing guidance and support for the family caregiver. So again, you can find all those local resources, caregiver support group, and our upcoming education classes and workshops by calling our helpline, which is another one of our awesome programs. Our helpline is available 24 hours a day, 7 days a week, and that's a toll-free phone number. And that phone number is 1-800-272-3900. Again, it's 1-800-272-3900. And so anyone can call that telephone number day or night, every single day of the year, ask questions, have advice, have guidance, get support, and also, again, find the information of the next upcoming workshop, if that's on understanding Alzheimer's and dementia, or if it's around effective communication strategies, or maybe it's our healthy brain and body workshop that we provide. So just a lot of really good information that you can find and talk to someone about the classes that are coming up. You can also find the information about the support groups and education classes and our helpline information fact sheets, information on our caregiver blog, lots of other great community resources specifically around COVID-19 as well. At our website, we have a very robust website that anyone can go to again, and that website is www.alz.org. So ALZ, A like Apple, L like Larry, and Z like zebra.org. So please take a little bit of time to check that out and find out about other resources that are available to you, again, anytime, day or night. Some wonderful activities that might be good for persons with cognitive impairment, like Alzheimer's disease or other dementias. That would include maybe vascular dementia, otherwise known as multi-infarct dementia, or Pick's disease, known as frontal temporal degeneration. So when thinking about activities, when I was posed this question, like what kind of activities would I do with my loved one? How do I engage my loved one? A person with Alzheimer's or other dementia doesn't have to give up those activities that he or she enjoyed, loved before this diagnosis. Many activities can be modified to your loved one's ability. And that's, I think, what we can remember as family care partners or caregivers is how can I create an activity or an idea through the day or make this task a little bit easier? How can I adjust to make this more practical for my loved one? So think of that when we think of activities that might provide some joy to your loved one. Really, in addition to enhancing quality of life, activities might be able to help reduce behaviors such as anxiety or agitation or wandering. And thinking of activities again, for even myself, I think about activities around the house that I might enjoy, or maybe an activity that's relatable to what career my loved one had when they were still working outside the home or in the home. Really trying to provide a feeling of connectedness, a feeling of being needed, of being valued. So an activity that we did with our own family was maybe instead of making a full meal for the family, maybe breaking that meal down into smaller tasks. So maybe instead of making mashed potatoes, we would have our loved one just peel the potatoes. And that was how they felt more connected to the activity of the day. Some other activities might be photography or bird watching, might be golf. So maybe not golfing a whole 18 rounds, but maybe just working on putting today might be a really fun activity. Some things that we can do in-house, again, since we're in, kind of the COVID sheltering in place, might be playing cards or listening to music. Playing cards, you might not play by the rules of the game, but kind of making things up as you go along to make it, again, a connectedness. Maybe when you're listening to music, maybe you get a spur of the moment fun that you want to do a little bit of dancing. Maybe your loved one has always enjoyed going to museums. So not sure if you know that, but right now they're providing a lot of virtual museum visits that are free to our community too. So hopefully, if you have access to the internet, you can check out some of those ideas too. Maybe an activity is around gardening. Maybe your loved one has always enjoyed putting in a summer or fall garden, and might not be something that you can do on one day, but just planning the garden. What would you plant in the garden? How big space do you need? What sorts of tools might we need to get? And then finally, another really great idea I found with our care partners, our family members who are caring for a loved one with dementia, might be having some virtual visits with family and friends, maybe setting up a Zoom meeting like I'm doing right now, make it pretty convenient, or maybe a telephone call. If it's not engaging for your loved one who has the cognitive impairment, then maybe thinking of other ideas. If it's not something that's going to help, again, engage our loved one to make a phone call or to engage in a virtual meeting if it's too confusing, maybe kind of putting that aside for right now. Some great ideas for caregiver stress, especially for coping, and especially during this time that we're in right now, during, again, COVID-19. Might be, care partners of individuals with Alzheimer's and other dementias should really, again, follow the guidelines from the Centers of Disease Control and consider the following tips. For people living with dementia, increased confusion is often the first symptom of any illness. And if a person living with dementia shows rapidly increasing confusion, you should really contact your healthcare provider for advice. And unless your loved one is having difficulty breathing or very high fever, it's really recommended that you call your healthcare provider instead of going directly to the emergency department. Your doctor might be able to treat your loved one without a hospital visit or without a visit to the clinic. Persons living with dementia might need extra support, extra reminders on a daily basis, maybe even written reminders and support to remember hygienic practices from one day to the next. I've seen family caregivers maybe placing signs in the bathroom and elsewhere to remind their loved one with dementia to wash their hands for at least 20 seconds. Maybe saying the alphabet, maybe singing the happy birthday song can make the activity fun. And for us as well as care partners, because it can be very stressful. So this would be another option. Or as a care partner, maybe we can demonstrate what a thorough hand washing is, kind of mirroring what I'm doing so that you can do washing hands as well as possible. Remembering the alcohol-based sanitizer with at least that 60% alcohol can be a quick alternative to hand washing, especially when it's more difficult for a loved one to get to a sink or wash our loved one's hands easily. Another good tip is maybe asking your pharmacist or asking your doctor about filling prescriptions for a greater number of days to help reduce those trips to the pharmacy. One less trip outside is going to be better. Thinking ahead and making alternative plans for care management of yourself as the primary caregiver in case you become sick, in case you need to have surgery. What would the plan be? This is a really good time to think about who might be able to step in at least for a short period of time. If it's an hour, or if it's a day, or if it's a long weekend, who could you call on in case something happens where you need extra support? Some other tips to manage stress for family care partners is just today, viewing on the public library website, the Facebook page, what community resources are available, who can you call to find out what is available out there to educate oneself, to get support. Again, you can always go to the Alzheimer's Association website to find out lots of great details about other community-based organizations in the area. Getting help and finding that support, setting up your support circle, your network, if that's neighbors, if it's family members, if it's dear friends that are your family, family doesn't have to be blood related. If it's maybe people that you work with now or people that you used to work with, who's in your support circle? Who can you call upon to say, could you pick up groceries for me today? Or could you give me Tuesdays off so that I can read a book, so I can make a call to my family member who is also sick across the United States? Who can that person be? This is the time where it's okay to ask for a little bit of help. I'm sure that you have been the person who has helped out too. So get that care circle started. Using relaxation techniques, it could be different for everyone, but some ideas for that might be breathing exercises, listening to music, whatever genre of music that you enjoy. Maybe it's meditation that helps kind of calm that stress in you. Again, just taking a break every single day, maybe twice a day, putting that in your routine, putting yourself on your own calendar, booking your own appointment to take care of you. Also, another great tip is continuing to do physical activity. It can really help reduce some stress that you might be under, or if you're not having a lot of stress yet, it will keep that really at bay. Any physical activity, that could be a recumbent bicycle, that could be something as easy to do every single morning and night, maybe lifting up your legs, doing some high knee lifts while you're brushing your teeth. It's not much, doesn't sound like a lot, but it can be really helping to just think of something outside of yourself so that you can rewrite your list, so that you can, again, put time for yourself aside. Relief from providing care. And if you set those things up early, then you'll be a healthier caregiver for much, much longer. And it's so much easier to be able to provide good care, healthy care, easier to find in your pack of strategies, your pack of little tips and coping strategies that are good for your loved one. It's easier to find them if you have that as a routine, putting yourself first. Becoming an educated caregiver is another great tip. Attending some of the Alzheimer's Association education programs to find out what to expect. You know, being just not knowing what can happen can be really frightening, and it's harder to be in that frightening place, not knowing what to expect. If you have a picture, if you have an idea, at least you can say, well, I've already prepared for that. I've put things in place where that crisis might not happen. A lot of times families will say, you know, these are great ideas, Denise, but how do I take care of myself? You keep telling me that. What I mean by that, as far as taking care of oneself, is making sure that you see your doctor, say, annually or more. Eating as well as possible, you know, eating a good healthy diet. Good energy coming in means good coming out. Getting good sleep. So that might not be 8 hours. If it's 6 really good hours where it's not interrupted, that's fantastic. Again, exercise can help with that. If you're physically active, even if it's, say, 30 minutes, 5 days a week, you know, that's a huge contributor for lowering your stress, keeping your cardiovascular health at a good thumbs up space. You have to worry less about high blood pressure. You know, you're just increasing that good physical activity. And then lastly, one of the other caregiver tips that I would strongly suggest to help with some stress would be to put your legal house in order. Take care of any legal financial plans as soon as possible. If you're not caring for a family member yet, and you're just viewing this Facebook recording, think of that for yourself, putting your legal and financial concerns in order. Great time right now, you know, we're kind of sheltering in place. Maybe you've got some extra time because you're not having to go to different meetings, is getting a hold of everything that you need to put into a binder so that you can share that with family members who might need to support you in the future. So reaching out to maybe Legal Services of Northern California, or if you have access to your family attorney, again, just to put that into place so that if you're not able to make medical decisions or financial decisions for yourself, you have a proctor who can do that for you. And that's someone that you can talk to about what you expect them to do. That role would be to carry out my wishes if I'm not able to. And it's important to have multiple conversations with that proctor so that they can carry out your wishes correctly. So now I'll move on to assisting a loved one who maybe lives in an assisted living facility or a long-term care facility. How do I keep in touch with them? You know, this is a really tough time because, you know, visiting a loved one right now is just not possible, maybe in some areas. So some tips for supporting persons with dementia who live in our long-term care settings or residential care settings. Again, I'll start with the Centers of Disease Control, has provided really good guidance on infection control, prevention of COVID-19 in the long-term care settings. And I'll say that this guidance is for the health and safety of the persons living in the long-term care settings. The precautions, again, are going to vary based on local situations. So one of the first tips is checking with the facility to find out what the procedures are for managing COVID-19 risk. Ensure that they have your emergency contact information, your telephone number, your email, maybe a couple of phone numbers, and the information of maybe 1 or 2 more family members or a friend as a backup. If they can't get a hold of you, who would you like them to connect with? Don't visit your family member in long-term care setting if you have signs or symptoms of illness. Depending on the situation in your local area, facilities might limit or not be able to allow visitors. And this again is to protect the individuals living in those settings. But it's really difficult if you're not able to see your family member. You don't have eyes on, you don't know how they're doing. How can you make that connection to know that they're in a safe place? So if visitation is not allowed, ask the care facility how you can have contact with your loved one. Can I call them on the telephone? Are video chats available? Can I do platforms like Zoom or Google Meets or Skype? Can I email the check-in? Again, if this is not comfortable for your loved one to be on a video call or telephone, if it's too distressful, maybe it's not a great idea to connect that way. So if your family is not able to engage in those calls or video chats, ask the facility how to keep in touch with the staff in order to get updates, because you want to know how your loved one's doing. They want to provide you with you're the family care partner, provide you with that peace of mind, help keeping you calm until you can see your loved one in person again. So how do we provide all these wonderful supports and services for our community, for our families, for all affected really with any type of dementia, if it's Alzheimer's disease or other dementia? So we have an annual walk, and that annual walk is very important to us. Our walks are held annually in more than 600 communities nationwide. Our walk is called the Walk to End Alzheimer's, and it's the world's largest event to help raise awareness and funds for Alzheimer's care, support, and research. This helps us to meet our mission. And our mission is that the Alzheimer's Association leads the way to end Alzheimer's and all other dementia by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. So this year, our Walk to End Alzheimer's is our signature fundraiser, and it will be taking place on October 17th. So although we may not be able to meet as a large group in person like we have done for years and years, we want to again abide by the standards of the CDC, of the Centers of Disease Control. We really want to bring families together in order to have an interactive Walk to End Alzheimer's this year. So on our website, again at alz.org, we've created a really wonderful idea and way that you can get involved. We have on the homepage, again at alz.org/walk, W-A-L-K, where persons can register for the walk. It's not too late to registering for the walk. You can sign up as a team captain, or you can join another team. You can help spread the word. You can let other people know through social media that you're part of this great movement to end Alzheimer's and all other dementia by getting involved. We'll provide tips and we'll provide coaching. Easy to raise funds if it's $5, if it's $10, if it's a larger donation, everything really, really helps. So in the morning of the walk, again on October 17th, you'll be able to take part in our interactive online experience throughout the day. So you'll be able to then walk wherever you are. If it's on your sidewalk in your neighborhood, if it's on a track, or if it's on a trail, wherever you are, there's a walk near you. So if you are walking in a small group, maybe you're walking with your family. I'll be walking with my family, with our 4 in total, because I know that my loved ones are safe. But I would encourage you to walk with us to learn more about how to support the Alzheimer's Association and the Walk to End Alzheimer's. So again, I want to take a moment to say thank you to Carrie Leos from the Stockton San Joaquin County Public Library for asking us to come on today and do a recording for their Facebook page. So thank you so much, and we look forward to hearing from you. Again, you can always call our helpline at our toll-free phone number at 1-800-272-3900, and check out our Facebook, or check out our website at alz.org. thanks so much for your time. Have a wonderful day. Stay safe and stay healthy. Bye-bye.